everybody else that's in the room. I don't know everybody, sorry, but I will soon. So welcome to our youth observation unit. We are going to do 3 tours. You'll see observation and an adult urgent care, so we will bypass those locations this morning. Annie, Andrea, do you have anything you'd like to say?
Kudos to all of you. And I'm so happy to be here with my colleague, Secretary of our Department of Drug and Alcohol Programs, Dr. Latika Davis-Jones, and with all of you. The fact that 3 counties have come together, places here. So congratulations to all of you. And I want to turn over to my colleague, Dr. Davis-Jones.
Well, I won't say much outside of the fact that I am really proud, DDAP is proud to be a partner in this effort to open another door for an opportunity for care when someone needs it the most. And so I'll be brief. Congratulations, and I'm excited to take a tour as I was not a part of the...
Would be an admission, so an individual would be admitted to the space for up to 23 hours and 59 minutes. So 59 minutes, yes. And so that large percentage of our individuals who are coming through the center are able to be used. So we're going to move through this way. We have a group room here. I'm just going to see behind you guys. So we, as you can see, we don't have beds. And that allows us to kind of flex our numbers up and down as needed with staff and per acuity and those type buckets. And then when admitted to the observation unit, we would then secure those items. And they would have access to a phone on the observation unit that we have on the wall out there. And then this is our staff entrance, staff area here. We also have a mother's room here, so any of our staff who are
You're all fine. Go.
Okay.
Go ahead.
Covers Central PA, and you just have to be able to connect through that. And then we have that interface so that no matter what EMR you're using or what system you're using, we can make it so you can see UPMC stuff and they can see yours or whoever.
this way.
Well, we are here today to tour the new Connection Center, which is a collaboration between Dauphin, Perry, and Cumberland counties to provide a mobile crisis, no wrong door place of stabilization for individuals who are experiencing any kind of behavioral health crisis.
And talk about the importance of having this building and having the space to do all this. You know, it's a new build. It looks great. It feels great to see it. Talk about some of that.
Yeah. This is such a warm and welcoming place, and it fills a really important niche in our crisis continuum. So the idea of a crisis continuum is that if someone's experiencing a crisis, they make that phone call. And sometimes it's really hard to get someone to make that phone call. So we want to make sure that when someone does make that phone call, there's a trained person on the other end of the line answering that phone. That's part of what happens here. Then, although most calls or most situations can be managed by phone, sometimes someone needs someone to respond. So there's a mobile crisis team that works in collaboration with Connections that can go out and actually meet somebody where they are. And then if somebody needs a place to stay or to come, they can come here. And they can come here for just under 24 hours. They can get their laundry, their clothes washed. They can get some warm food in their belly. They can have a chance to just take a breath, be evaluated, and get connected with the services and supports that are individually tailored to them.
I think it's also pretty significant that I believe this is the first one of these in the whole state of Pennsylvania. is that correct?
Well, there are similar places, but what's so wonderful about this one is that it is a collaboration between 3 counties. You know, many of our smaller population counties simply cannot afford to stand up and maintain something like this. And so at the Department of Human Services, we've been encouraging counties to collaborate together. And these 3 counties have done that with just a phenomenal result here at Connections.
How does this kind of work, this atmosphere fit into the bigger picture, you know, where you want to be in the future in terms of behavioral health services?
Yeah. Governor Shapiro has prioritized increasing funding for behavioral health services in lots of different ways. And this is an example of really meeting people where they are. And by that I mean that historically, the only place for someone with a mental health crisis to go is to call 911 and usually be taken to an emergency department. The police, and I have enormous respect, and they do incredible work, but this isn't really their wheelhouse. Police aren't really trained to provide emergency crisis behavioral health services. Neither are our hospital emergency departments. And so the beauty of a place like this is that you can avoid police, come straight here, or have mobile crisis bring you straight here, where there's a group of trained professionals. There are peer supports here, meaning people with lived experience in both mental health and substance use disorder here to work with clients. This is the type of environment and care that people in a behavioral health crisis need. That's really tough to find in most of our hospital emergency rooms.
Talk about the places that, you know, feature those smaller populations. This is the first to have this collaboration. Are you hearing of plans from other places at this point?
So as a former county commissioner, I really do understand how difficult it is to stand something like this up. You know, there's just the capital costs of creating this beautiful space, and then of course you have to have that operational budget to keep it running. And so for smaller counties, it's just not possible. Even with funding, you know, both the Department of Human Services and the Department of Drug and Alcohol programs have contributed to creating this space, but no one county that's a smaller county can possibly keep something like this going. So we've been encouraging counties to come together, and these 3 counties, Dauphin, Cumberland, and Perry, have just illustrated why that can be such a successful model. And we are absolutely seeing other counties look at this. In fact, in the governor's budget this year, $5 million, a new $5 million was appropriated in order to help stand up places like this in counties that currently don't have them. And I know at least 1 and possibly 2 of those awards went to counties that were joining together to do work like this.
Yes, we're here today to come to the Walk-In Center here in Dauphin County. It's a collaboration between Dauphin, Cumberland, and Perry counties to meet the behavioral health needs for those that reside in this geographical location.
It's a great collaboration here with DHS. Talk about DDAP's role in this and what kind of services that you'll be working with here.
Yes, so a part of our role is to provide support and funding through this initiative. Through our opioid settlement funds, we were able to give $2 million for crisis stabilization services, and that will be a part of what this opportunity is. And so we're excited to collaborate. We do know that substance use disorder and mental health disorders are impacting every county across Pennsylvania, and the Shapiro administration is getting the job done by making sure that we're streamlining and investing in making sure that services are accessible for individuals that need it the most.
How does this kind of work fit into the bigger picture?
It's really a part of our service continuum. We need to make sure that we have a variety of services available to meet the needs of those that reside here in the Commonwealth. So we're talking about outpatient, inpatient, and this is a walk-in crisis center. So we can get people evaluated, we can get them the services that they need, and do that in as real time as possible. And it's going to also reduce the burden on not only first responders, but law enforcement, along with emergency departments. They can come here and get their needs met right away.
The importance for people in rural communities who are struggling with behavioral health. We don't have as many of these in those
Yes, stigma is alive and real, and we have to continue to have the conversation to let people know that there is no stigma associated with getting help, and thus the reason why we have our Life Unites Us campaign. We're out there spreading the word around behavioral health, making sure that people know what services are available, and we do need to continue to expand services such as this across the Commonwealth. So we're looking at rural communities along with urban community settings as well. So we know that there is a need, and we'll continue to promote the use of such services and continue to reduce stigma. Thank you.